That's something that we all seen healthcare is getting scaled back over time, and there's been a push to get everyone into the home quicker and to limit intensive care services. So what we're seeing for a lot of people is what they call authorization of care is shrinking and shrinking. We're having to fight for the people we serve for what we feel like are appropriate lengths of stay.
Hi, I'm Brittany, and a brain injury survivor and member of Bind.
And hi, I'm Carrie, a stroke survivor and a member of Bind as well. And today we're joined by David Salisbury. He's the Director of Clinical Operations at Pate Rehabilitation, with a deep commitment to bringing commitment to helping brain injury survivors thrive. David combines clinical insight with advocacy to expand access to meaningful, life-changing care. So welcome, David.
Thank you all for having me today.
We're excited.
Opinions shared by the guests of the show are their own and do not necessarily represent the views of the host, bindwaves, or the Brain Injury Network. This podcast is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a healthcare provider with any questions you may have regarding a medical condition. Thank you.
So, share with us a little bit about what drew you to the field of brain injury rehabilitation and advocacy.
I've been doing this work since the 1990s, and I started my training in brain injury care, and I absolutely loved it. It's one of the populations you work with where you see people getting better, you see miracles all the time, and I always found it rewarding and very humbling. So I've stayed with it, and as I've gotten through my career, the advocacy piece has taken a priority because we have so many limited opportunities for people to get the care they need. So that, to me, is the most powerful issue we have to address today.
So, what does your role as Director of Clinical Operations at Pate Rehabilitation entail on a day-to-day basis?
As you can imagine, every day looks very, very different. We have multiple sites across Dallas-Fort Worth, so I rotate between those sites, help manage our clinical care, guide our programming and our research, and just problem solve on a day-to-day basis. So there's probably no 2 days that look the same.
Yeah, I was going to say, it's probably the same as we hear a lot. When you've met a brain injured person, you've met one brain injured person. And then
Right.
you've met the next person, you've met a brain. So I can only imagine, when you're actually working in the clinical setting, how much that can change on a day-to-day basis.
Just like your jobs here at Bind probably look very different day after day.
Very true. So how has Pate's mission evolved in response to changes in the changing needs of injuries over survivors?
Right, so Pate's been around for about 4 decades, giving care. And when it was first created, it was created because there really weren't options when you left the hospital. And over the years, it's expanded to multiple sites, more levels of care. And so now we can almost treat people from when they leave the hospital all the way into the home setting. So the company is trying to provide ways to minimize the gaps in care that people experience. For most people, they get some really nice, intense care in the hospital. Once they leave the hospital, though, there is a void, either because geography, you can't find providers who understand brain injury care, or because of funding. So we're working a lot to try to minimize those gaps.
Okay, so, and I know a lot of things, and that includes Pate. And
Right.
so before I misspeak, before we get too far, so Pate and Rehab Without Walls are under the same umbrella company now?
Right. So Pate was a family business, and for decades and decades, the Hayden family ran that and grew it. And then, a handful of years ago, got bought out by Rehab Without Walls. So it's basically running the same way as it always run, but now we have a parent company that allows us access to more lines of care, and then also care across the country as well. So we can work with other arms of the company to provide care outside of our geographical area. So if we have someone who's coming to get treated by Pate from another state, we might have branches in their home state that they can transition care back to.
Okay, so Pate's not just DFW specific, it's...
The Pate locations are the Rehab Without Walls. It's national.
I knew Rehab Without Walls, but that's what, so Pate, and does Pate, I know Pate Anna has more of the live-in situation. Are there any other live-in Pates in the area?
Yeah, so all of our locations have residences, and for many people, if they can't get home after they have a brain injury, they're in a hospital, then we can help provide care for them. For a small select group of people who really can't reintegrate back to home or back into other living situations, then we do have a residence up in Anna for people to live with us long term. And so we've had people there for decades and decades and kind of consider them like our family.
Okay, I didn't realize that. I was thinking more just the short term. I didn't realize y'all actually have long term living too. That's cool. See? Ask the right questions. You can learn new things. That's why I said I know a little about everything.
So how does PATE track and measure survivor outcomes after brain injury rehabilitation?
Right, so it's kind of a 4-layer answer. On one layer, we do something called the Mayo-Portland scale, which is a way you rate people on how they're doing cognitively, how they're physically getting better, emotionally getting better, and then how they return to their prior roles in life. And so that's kind of the gold standard in our industry. So when we talk about doing research and creating advocacy information, that becomes the common tool to talk about progress. Now, no one comes to PATE to get a few scores on a Mayo. You come to get better in life. So our teams have functional goals of walking, swallowing, toileting, driving, return to work, all the things that we care about for quality of life. So we measure those goals, and then we have another layer, which is our patient-centered goals. So whatever person comes to PATE with, that survivor dictates what goals they want, and then we track those as well. And we roll a lot of our data up into a national database. So the idea is we can tell you how people do at PATE, and that's nice, but advocacy means more than just one company. And so we have companies across the country, and I've created the first national database for post-hospital care and brain injury, and we can now use that data across organizations, hopefully help insurance and payers understand the value you get for the care you get. And so that's kind of all the ways that we're looking at outcome right now.
Okay, well, that's neat that, you're building a national database, because that kind of gets to our next question is, can you give us some examples of how that outcome data has directly influenced or is helping you influence the advocacy efforts for better care access?
Right. So, in the past, people would talk about their company and try to tell a payer, hey, we have great outcomes. Well, then the payer says, of course you're going to say that because you're getting paid by the company. Now that we have probably over 4,000 people in the database. So when you're talking to a payer and you can show them data of that many people and show them that across different companies there is value for this care, it changes the nature of the conversation. As you guys know, insurance is really trying to minimize costs, and the length of care has gone down a lot. So when I started in brain injury care, people might be in the hospital in a rehab unit for months at a time. That's now a few weeks. So if you take away all that time in the hospital and you're getting people out of the hospital quicker, where are they going to get their care? And so it's got to be outside the hospital. So companies like ours and many other companies are trying to advocate for people to have longer stays and longer care, because once they leave the hospital, they're not at the point of recovery they used to be at. And so now what we have is the data to show a payer that, hey, if you give us another month or two, here's where a person could get. And when you're talking about large groups of people, that becomes much more powerful than just talking about your own company. So we do that on the individual level for the people we serve. But then on a national level, we've been doing research papers to try to create kind of a foundation to showcase what we all know. You guys have lived it. You've seen it through Bind. We all know people can get better.
Right.
And what our data shows is that if you take a good treatment team, right, a physical, occupational, speech therapy, psychologists, counselors, all the usual people, and you go by what they recommend for a survivor, if you give them that level of care, you get the best outcome. And then we can show with our data, if you give them less than that care, the outcome is worse. If you give them more than that care, the outcome doesn't get better. So the treatment team really does have a good handle on the right dose of care someone needs. And so I think that's a powerful message to tell insurance companies and payers, that you can trust a good group of specialized clinicians to create the right duration of care.
So, and this is maybe kind of off topic, but now I'm just thinking, what is the average inpatient time? Because if I'm just thinking about my recovery, I went ICU, CCU, vice versa. I don't know which way they go. ICU, CCU to inpatient hospital. I was in the inpatient hospital maybe a month and a half before I went to day neuro. So is that a typical stay, or you're saying that's getting shorter now?
So you opened up and said that each person is a
Yeah.
N of one. Each person is so different. So it really depends on the injuries, what kind of hospital care people get. We're seeing a lot of rehab stays. So when I talk about hospital stays, I'm not talking about the ICU and the acute medical part, but we're getting to the rehab part where people are
So
a little more
the
medically
inpatient.
stable. That's going, 2 to 3 weeks. A lot of times what we're seeing for the people who move on to PATE, which, as you guys know, that's not a lot of time of care. So again, it expands the need for care when you leave the hospital.
No, totally. Okay. So that's right. Yeah.
So how do you ensure that survivor outcomes are translated into meaningful, actionable policy recommendations?
That's a beautiful question. So, and if I'm understanding it right, what we try to do is create the data that people want to see using the gold standard data, but then also have metrics that tell us about quality of life. How many people get back to work? How many people drive? And then we follow people at 3 and 12 months after they leave us. So what we can say is for a year, here's how someone does in brain injury care. So again, that's speaking to not only that if you pay for this level of care, you're getting a certain outcome, but that outcome, at least in our data, is showing across all these companies, those improvements stay for at least a year. We don't measure past that, but again, it's showing that there's value to that. Now, when we talk about from a policy standpoint, we're working at the local levels to try to fight against any healthcare bills that are going to limit people having access to cognitive rehabilitation, which is really the care that we're all talking about after the hospital. And then we have people at PATE, I know other organizations do that as well, that go to DC for some of the Capitol Hill days, brain injury awareness days and such, and try to advocate at the national level, mainly to make sure that there's access to care. I think that's what we're really talking about here, is people having opportunities and choices when they leave the hospital.
Yeah, absolutely. We have one of our members. She's been doing it for a long time, but I think she does it more on her own. She goes to DC.
Wonderful. Yeah, I think that's something that all your listeners should look into and do. The voices of the survivors is much more powerful than any voice like mine or people who are in the industry.
Yeah, we try to get a little bit of everyone. So.
Yeah.
So what are, and this is, I guess, there's probably a ton, but what are some of the biggest barriers that brain injuries find in finding accessing appropriate care? I mean,
right, so we've hinted at two of them. The biggest one is the funding issue, right?
Sure.
That's something that we all see in healthcare is getting scaled back over time, and there's been a push to get everyone into the home quicker and to limit intensive care services. So what we're seeing for a lot of people is what they call authorization of care is shrinking and shrinking. We're having to fight for the people we serve for what we feel like are appropriate lengths of stay. Again, that's not unique to our company. Everyone I talk to across the country is dealing with similar challenges. So a lot of it is really advocating for, even at this individual person level, please let us have the opportunity to do our jobs and make someone better. Now, we're in DFW where we have a lot of wonderful resources and great healthcare providers who are very familiar with brain injury. When we go to more rural areas of Texas, and any other state I've lived, it's been very similar. You don't have people who feel as comfortable treating people with a brain injury. You don't have the resources there, and there really is a vacuum of care. And to me, that's the challenge right now. And you can have as many virtual sessions as you want, but sometimes you just need to be in person with people who have a brain injury and work with them in person. And that's the piece that I think is missing. And we're advocating for increased resources and funding for us to meet the need of all these people.
is there a way that we, and I say we, like survivors themselves, can help in that effort? I mean,
Right. Yeah. So I said it right before. Is I think
just the DC and.
I think even at the local level, whether it's organizations like this, the Brain Injury Association chapter in Texas, all of these organizations will get you in the pipeline. And for those people who feel comfortable, then being able to meet government individuals either at the state or the national level is so powerful. Because again, if we're sitting in a group of people and someone is talking to one of you directly who's a government official, they're going to get moved by what you say much more than what I say. The research and numbers, what I can speak to my job experience, pales in comparison to you being able to speak about what you needed that you didn't get, what you see that we need to expand. those matter. So those voices matter a lot. When we talk about certain health conditions, think about like cancer or autism, you have some wonderful advocates for those big groups in the country, and they're very loud, and they do some great things for funding. We don't have that so much in brain injury, and that's one of the things that we need more of that.
So I'm trying to figure out how to do it. Okay.
Yeah. So what policy or systematic changes do you believe would most improve access to brain injury rehabilitation?
So for decades, we've been talking about brain injury as a chronic condition, and that's nothing new in the field, but Brain Injury Association of America has done a great job, even with some recent publications, distributions, to help us promote that idea. And as everyone who is here can speak to, when you leave the hospital, your brain injury's not fixed.
No.
Right? It's something that you're learning to adjust to over time. Your family's learning over time. And as we all experience in life, and people with brain injury maybe even a little more so, there are ebbs and flows in how you're doing. And so particularly in the first couple of years of care, the more intense care you can get, the better. But when we talk about long term, there may be care needs 5, 10, 15 years down the road. As you go through life cycle changes, that a brain injury might become more challenging to recover. And I think having that longitudinal idea of it being a chronic condition helps the payers understand that we're not just paying for a couple weeks or months of care and then we forget about this person. But this individual may have long-term needs.
Okay, I like that. I'm going to take a quick little break and just remind our listeners to go ahead and click that like button, that subscribe button, that notify button, whatever has a thumbs up. Go ahead and click that button and keep on listening. So now, Becky, so that kind of goes into a little bit what we've already been talking about, and I think it's more than just at the state and local level, but I could be wrong. So the other question was, how can the healthcare professionals and advocates work together in bridging gaps in the post-acute? I mean, that's kind of what we're talking about, right?
Yeah.
Maybe that's something that would be, because I do this so much that I forget. So explain what, maybe for our listeners, what post-acute means.
Right. So I think about it as the acute care in the hospital. And that's when you're in a hospital system and you might move from an ICU to acute care floor to a rehab floor. And then once you leave the hospital, everything after that is called post-hospital care or post-acute care, whatever phrasing you like. But it's the idea that you're good enough to leave the hospital, but you still have some care needs. And so there's a whole range of services after that. And I think just this conversation is exactly what needs to happen. We need education for people who are treating individuals with brain injury and for brain injury survivors and their families in the acute stage, in the hospital stage. Set the expectation that this is the level of care you can get, the duration you can get, and please advocate for that. Because again, we go back to the advocacy piece at the survivor level, the family level, and then the clinicians who are in those hospital settings to know and to understand and share with the survivor, here's what's out there for you. I think if we get that education, that communication, that is incredibly important. And then going out in the community, educating kind of our other care providers who may deal with and serve people with brain injuries at other levels to understand how can you plug them back into resources when they need that extra care of a lifespan. So just the awareness of the levels of care and the type of care, I think would do wonders just for people to get the care they need.
Okay, and just I make sure, like, again, processing it in my brain.
Right.
And to push it back out there that way. So our post-acute is going to be our outpatient, our day neuro, our rehab without walls, our paid locations, our CNS. That's all our post-acute.
And there's different terminology from different companies in different states, but the idea is when you get out of the hospital, some people will need to stay with a provider, and that might be what we call residential care, where they're getting care 24 hours a day. Some people are good enough to get home, and they may come in for a day program. So for us, it's a 6-hour program in a day where they get all their therapies, but they go back home. And some people may just need outpatient care, where they go into a clinic or an organization for maybe 1 or 2 therapies a week. And then some people may do better with care brought into the home, and that's called home and community care. So again, there's a range of services, and they're matched based on what a person needs and where they are in their recovery.
And I know even just, my stroke was 16 years ago, and I'm sure there was home health care back then, but I don't remember ever hearing about a rehab without walls or any of that. I was looking at where I was, there was a day neuro program, and I lived close enough that they would come and pick me up and take me back and forth. But I was not in a place where, if I couldn't have stayed with my parents, that I could have been left alone all day at home alone. That was not an option.
Yeah, I think the care options have definitely gotten better over the years. The challenge is having the insurance coverage to get the care, and that's where the advocacy comes back in.
Okay, yeah. Okay.
So what role does survivors themselves play in advocacy and shaping the future of rehabilitation programs?
And we've kind of danced around this a little bit, and I think I'm pretty passionate to say that the voices of survivors is the voice that needs to be heard. So when we talk about where I think healthcare is going, with all the cuts and the scaling back and difficulties with access to care, while the research and all the papers are nice, I don't think they tug the hearts of the people who ultimately are going to make the decisions. And that's where I think if we can pair up some of this hard science that we have with the voice of survivors and groups of survivors, we have the best chance to help people understand the value of care and access to care.
Yeah.
Especially like when insurance is like, oh, they're done because they've been plateauing, but do the insurance person know, like a brain injury, they don't. So they don't know how hard and challenging it is. Like you can be good one day and you can be worse the next day.
But a plateau for them might be a plateau in numbers. Whereas the improvement you might make from week to week is something that doesn't come across on a scale, but it's a quality of life issue. So in those circumstances, sometimes what we have is a family member or even a survivor is able to get on the phone with an insurance provider and advocate for themselves. And to be honest with you, they have a better success rate sometimes than our staff do who are trying. They do wonderful jobs. But, when you're talking to someone and they're directly dealing with the injury, it changes the conversation greatly.
That's interesting.
That's good to know.
Yeah. So I'm going to jump ahead a few questions here because it looks like we're getting closer to time. So, and I kind of feel like we're answering all our questions are kind of giving us the same answer. So I'm trying to see if I can ask this in a different way. But it says, "Well, how do you envision the future of advocacy evolving in the next decade for brain?" But I think we're pretty much making that case there is we need to figure out a way to get back to the level of the people or get to hear Brain Injury Network. We need to find a way to make our voices heard much bigger, and we need to find a way to encourage survivors. It sounds like, I don't know. So that's kind of.
That's a good question. But then also, what message do you also want to call for our our listeners too, who want to support greater access to brain injury rehab services? So what can they do?
I think we're going to go back to what we talked about, being able to educate yourselves and your providers as well. A lot of the physicians you follow up with, or the teams you follow up with, will not know about some of the levels of care that we spoke about. And so whether you reach out to an organization like mine or any organization you feel comfortable with, ask them for resources, and most of us will be happy to give people the education they need so they can go to their providers and ask for the level of help they need. And I think the education, at that level will then impact not only the care for that survivor, but hopefully survivors in the future as well. And I think that's where we are, is really in the education piece right now.
I think so too, because I know, like you said, and that's a whole nother, I guess, thing. It's like, maybe a year or 2 years down the road, I realize that my balance has gotten a little wonky again. Can I just go in and get some outpatient therapy again?
Are you asking me?
I mean, yeah.
Sure. And I think that's where you might be going through your PCP or whoever is following you, but I think that's the conversation you have. And then if you're feeling like you're not getting where you need to go, reaching out to either the brain injury organization like Bind, or a provider like ours, and getting the resources you need. Doesn't mean you have to go to one of us. It just means you get the information so you can get the care you need. But that's when we talk about it being a chronic disease, that's what we're talking about. That it's not, your balance wasn't.
You never get it fixed.
Yeah.
Right. There's got to be some ebb and flow in how you feel like you're moving, and you might need what we call just like a booster session or two to get yourself back on track.
Okay. I mean, I think that's good for survivors to know, is that it never hurts to ask for more care, more recovery, more therapy. You may get a no, but it never hurts to ask. So,
this journey's a roller coaster because you'll be fine, and then for months you'll be fine, but then all of a sudden you'll start declining. Like, I went through a decline. I actually like what you said, a booster. Like, okay, you're declining, you need help. Let's go in for a booster, to boost you back up to a good point. So.
Okay. Well, and my last question I'm gonna ask, is there anything that we didn't ask or that we haven't covered that you think is important for our listeners to know, or just some advice that you would like to share that's good for whether it's a survivor or just a caregiver or just the general public?
I don't think I have any questions. I do hope your listeners know how unique you guys are. I mean, the clubhouse model has not been able to succeed in a lot of areas. So the fact that we have a few of these in Texas is absolutely wonderful. So for those who've never been here, I'd recommend they come, they walk through, they understand what you do, and they consider becoming involved, because when we talk about quality of life and getting people back to meaningful roles, Bind is a great example of that.
Thank you for that. We're a little proud of ourselves, and we like
You
that
should
people
be.
are getting to know us a little better. And like I said, I'm a founding member, so I've been around since before there was a building, so it makes me happy. My little heart happy. But David, thank you so much for coming in.
So
and
nice to meet you
for
all.
sharing your experience. We appreciate everything that you do, and so
Yeah, and thanks to our listeners for listening. And remember, you can find our new episodes on all your favorite platforms. Until next time.
Until next time.
We hope you've enjoyed listening to Bindwaves and continue to support Brain Injury Network and our nonprofit mission. We support brain injury survivors as they reconnect into life, the community, and the workplace. And we couldn't do that without great listeners like you. We appreciate each and every one of you. Please remember to click the like button, the share button, and the subscribe button on YouTube. And follow us on Instagram at Bindwaves and Brain Injury Network on Facebook. You can email us at bindwaves@thebind.org or go to our website, bindwaves.org, or call us at 972-769-2463. Please continue watching. Until next time.